The word pathology is derived from the two Greek words. The one is pathos, which means is disease or the suffering, and the logos, which means study. Whenever you see the word logy, like in sociology, and like hematology, the study of blood, like histology, study of tissues. So you will see these type of words frequently in the medical sciences. So it's basically a scientific study of the change or changes in the structure and the function of the body in disease. In simple language, disease is opposite of the health. Means what is not healthy is disease. And health may be defined as a condition when the individual is in the complete state or is in the complete accord with the surrounding, while disease is loss of ease, loss of comfort to the body. It is important for a beginners in pathology to be familiar with the language, specific words used in pathology, like, and as you can see, patients. What is patient? Patient is the person affected by the disease, and you will frequently see the term lesions in the field of pathology. Lesions is the affected area, the disease area, and is defined as the lesions, the characteristic change in tissue and cells produced by disease in an individual or experimental animal lesion. And the term pathological changes or the morphological changes basically is the consists of examination of disease of the tissue. If you are seeing any diseased tissue with your naked eye, then it's known as gross or microscopic examination. And if you see the tissue, the diseased tissue under the microscope, then it's known as the microscopic examination. The term pathogenesis is basically what is the mechanism, by which mechanism the lesions are produced, is basically known as pathogenesis of disease. Means how the disease occur. Uh, the terms like symptoms and signs, basically you will see this type of terms in your clinical practice. Uh, like the symptoms are those lesions felt by the patient. Means आपको एक आप पेशेंट हो, आपके आपको जो प्रॉब्लम हो रही है, आप जो बताओगे, जो आप देखोगे, वो सिम्टम्स हैं. And those discovered by the clinicians are the physical science. यानी और वो जो आपका डॉक्टर, ट्रीटिंग डॉक्टर जो है देखेगा आपके अंदर, वो कि बेसिकली साइंस कहलाएंगे. Few words about the evolution of pathology. Pathology as a scientific study of disease processes which has deep roots in the medical history. It's evolved over the years as distinct discipline from anatomy, medicine, and surgery in that sequence. As in the prehistoric times, reveals that religion, magic, and medical treatment were quite linked to each other in those times. The link between the medicine and the religion became so firmly established throughout the world that different societies had their gods of healings. Like for example, mythological Greeks had Apollo, which considers as the principal gods of the healing. Dhanvantari, like the Devata of medicine in India. But the real practice of medicine begins with the Hippocrates, or you can say Hippocrates. These are the great Greek clinical genius of all times, and they are regarded as the father of medicines. They basically dissociated medicine from religion and the magic. Instead, they firmly believed in a study of patients' symptoms and described methods of diagnosis. Modern pathology, um, half of the 20th century until recent times, have made it possible to study diseases at the genetic level or the molecular level and provide an evidence-based and objective diagnosis that may enable the physician or treating doctors to institute targeted therapy, like description of the DNA structure of the cells given by the Watson and the Crick in 1953. Like as well, identification of chromosomes and their correct numbers in humans, which is 46 chromosomes in humans, basically in tissue somatic cells. It was given by the Levin Ontario in 1956. And the era of stem cell research, very important one. It started in the 2000. Basically, it is the primitive cells isolated from the embryo and maintaining their growth in the laboratory. So there are two types of stem cells in humans: the one embryonic stem cells and adult stem cells. The embryonic stem cells being more numerous. Stem cells are seen by many researchers as having virtually unlimited applications in the treatment of many human diseases like the Alzheimer's disease, diabetes mellitus, cancers, stroke, etc. Another term, telepathology and the virtual microscopy. Basically, telepathology, as the name said, is defined as the practice of diagnostic pathology by a remote pathologist by utilizing images of the tissues of the specimen transmitted over a telecommunication network. So the main components of the telepathology system, like as conventional light microscope, method of image capture, commonly a camera mounted on the light microscope, microscope और कैमरा लगा हुआ होता है. Telecommunication link between sending and the receiving side, workstation at receiving end with a high quality monitor. The important one, like subdivisions of pathology. Human pathology is conventionally studied under two broad categories or the divisions. The one is general pathology, which deals with general principles of the disease, and the other is systemic pathology, which includes study of diseases pertaining to the specific organs and the body system. In general, the study of pathology includes morphological, which is either gross examination or the microscopic examination, and non-morphological disciplines. Under the headings of morphological branches, we have histopathology, cytopathology, and the hematology. About non-morphological branches, these diagnostic branches of pathology include clinical pathology, clinical biochemistry, microbiology, immunology, genetics, and the molecular pathology. Microscope may also be required for at least some of these lab tests. Morphological branches, as said, these branches essentially involve application of microscope as an essential tool for the study and include histopathology, cytopathology, hematology. मीन्स इस ब्रांच के लिए ज़रूरी है कि आपके पास माइक्रोस्कोप हो, उसकी बेस पे आप स्टडी करते हैं. और इसमें तीन बड़ी कैटेगरीज हैं जिसमें हिस्टोपैथोलॉजी है, साइटोपैथोलॉजी है, हेमाटोलॉजी. सो व्हाट इज हिस्टोपैथोलॉजी? हिस्टोपैथोलॉजी basically also known as anatomical pathology, surgical pathology. In Australia, it's basically commonly stated as anatomical pathology, or you can also state this as tissue pathology. Basically, it is the classic method of study and still the most useful one which has stood the test of time. Anatomical pathology include the following subdivisions like surgical pathology, which deals with the study of the tissue removed from the living body by biopsy or surgical resection. The other is experimental pathology. This is defined as production of disease in the experimental animal and study of morphological changes in organs after sacrificing the animal. The other is the important one, the forensic pathology and the autopsy work. In this type of study, you are going to study the organs and tissues removed at the post-mortem for medical legal work and for determining the underlying cause of the death. The significance of a careful post-mortem examination is appropriately summed up in the old saying, "The dead teach the living." Cytopathology, it includes the study of cells which are shed from the lesions, known as exfoliative cytology, and the fine needle aspiration cytology, which is from the superficial or deep-seated lesions for diagnosis purpose. The hematology basically deals with the disease of the blood. Means what are the diseases associated with the blood is known as the hematology. It includes laboratory hematology and the clinical hematology. In the clinical hematology, basically you are also going to treat the patient. You will see a term frequently used in the histopathology, basically known as frozen section. Frozen section basically a pathological laboratory technique used for rapid microscopic analysis or diagnosis of a specimen disease under the microscope, usually used with oncological surgical uh, consultation. It's basically a rapid diagnosis test that can guide intraoperative patient management. In the heading of non-morphological branches, as we said or discussed, the one is clinical pathology, which is basically the analysis of various fluids, including blood, urine, semen, CSF, and the other body fluids, which included in this branch of pathology. The analysis may be a qualitative one, the semi-quantitative, or the quantitative. Immunology is basically the detection of abnormalities in the immune system of the body. Comprises immunology and immunopathology. If you are studying the immune system, then it's immunology, and if you are studying the disease associated with the immune system, that's known as immunopathology. About the medical genetics, this is the branch of human genetics that deals with the relationship between heredity and disease. There have been important developments in the field of medical genetics, like, for example, in blood groups, inborn errors of metabolism, and the chromosomal abnormality. Microbiology basically is the study of disease causing microbes or the microorganism implicated in the human diseases. Depending upon the type of the microorganisms involved or you are going to study, it has further developed into categories like bacteriology, parasitology, mycology, and virology, etc. For example, bacteriology, if you are studying or seeing the case of a bacteria and associated with the disease, then it's called bacteriology. And if you are studying the parasites, then it's the study known as parasitology. And if you are seeing the cases of the fungus or studying the fungus, lesions, fungus, organisms, that is known as mycology. And if you are studying virus, that is known as virology. Like in the case of we have having the coronavirus, and if you are studying the coronavirus, then it's come under the heading of the virology. Molecular pathology is the detection and the diagnosis of abnormalities at the level of DNA of the cell. It includes the tests like ISH, which is known as in situ hybridization, and the PCR and etc. Like the PCR, like in the presently we are dealing with the disastrous viral infections, uh, COVID-19, also known as SARS-CoV-2 coronavirus. For detection and a diagnosis of coronavirus, presently we are dealing with is by through the PCR test, known as RT-PCR. So molecular pathology is as much important as you can imagine that the presently the diagnosis of the COVID-19 or the corona case required PCR test. These methods are now, as said, not only used for the research purposes, but are now being used as a part of diagnostic pathology reports, as we are seeing by giving you example of the coronavirus COVID-19 test RT-PCR for diagnosis purpose. Summarize quickly the introduction to the pathology of this session. Like pathology is the study of structure and the functional changes in the disease. Pathological changes present with clinical features like symptoms and the signs in the patient. In pathology, we study causes, which is known as etiology, the mechanisms known as pathogenesis, and finally arrive at the final diagnosis by various laboratory methods as we discussed, and by the gross examination known as macroscopy or morphology, and by microscopic examination of the tissues in the Major's method. The father of medicine is Hippocrates. The father of modern medicine is Sir William Osler. The father of pathology is Rudolf Virchow. Morphological branches of diagnostic pathology are histopathology, cytopathology, and the hematology. Important ancillary diagnostic techniques in pathology are immunohistochemistry, the cytogenetics, and the molecular methods like I mentioned ISH and the PCR, which is known as polymerase chain reaction. Hopefully, this session is useful for you guys. For any, if you have any query, uh, you can contact me myself as well, or by in the comments. And if you like, so please kindly like as well. Stay blessed, stay safe, and stay at home. Take care.